Hey, doctor, how you doing?
Great to see you. Um, I have an idea why you're here today, but why don't you tell me what you're here for
Yeah.
exactly?
Pretty much wanted to get more information about the procedure, wanted to know how long it lasts, and pretty much any details that you could tell me about how it works.
So, how it works is the right question. There's been a lot of techniques for penile girth enhancement throughout the last, say, 30 years, and none of them have ever gained traction because they weren't effective.
Right.
The UroFill technique is a patented, standardized, reproducible technique for penile girth enhancement. And it is a process. And this process requires some time and some investment by you. But for guys that just want a little extra, there's nothing that compares to it. And the way we go about doing this is we stage these injections of something called hyaluronic acid, which is in your skin. It's part of your body. It's a safe material, and we inject them through a patented process where you were able to gain exactly what you want and when you want it. The beauty of this is not something where you go to a doc and the doc says, okay, I'm going to do A, B, C right now, and you're going to have your end product that you have no say in. You absolutely have every bit of say in the way your penis is constructed or reconstructed when we're using this technique. Usually, guys will require 2 or 3 visits here in order to get to where they want to be. But again, I want you to know, brother, that you are going to tell me, hey, Paul, I like this. I don't like that. I want to get right here, and we will get you to where you want to be.
Okay. Okay. Awesome. And is it painful?
Yeah, that's a great question. Nobody has ever said it's too painful.
Right.
Maybe
Okay.
because, but in reality, it's a non-invasive or minimally invasive procedure. It's done here in the office. You
Right.
might feel an injection, but it's the pain is minimal. And like I said, we have never ever had somebody say, "I'm not going to go through this because it's painful." If you come here at lunchtime, from your work, you go right back to your work. If you want to work out that day, you get to work out that day. The only thing you don't get to do is have sex, and
Okay.
that's for 3 days.
Okay. Okay. That sounds pretty solid.
Pretty solid.
Yeah.
All right. So the way it works is today we're not going to do this on camera, but we're going to examine you. I'll give you an idea of where we think you're going to be. We don't inject more than a certain number of units each time because we don't want your body to eat it up.
Right.
And we don't want to waste your money. This stuff ain't cheap, and we want to make sure we take advantage of this space that we are creating where the hyaluronic acid is not recognized by your body. So
Right.
that way, we have guys that 10 years down the road still in the phallus. It's still in the actual body of the penis, and
Right.
that's what we want. Is we want for you to get to where you want to be and keep it.
Okay. Okay. All right. Perfect. So yeah.
Ready?
Yeah.
Let's
Let's
hit
do
it.
it
Let's hit it, brother.
for sure.
Okay.